Assalamu alaikum. Today our topic is about the practical of the cell injury. It's going to be presented by me, Dr.Amna Bashier, a histopathologist and assistant professor at Taif University. We have divided cell injury into two lectures: the reversible cell type and irreversible cell type. But when we talked about the reversible cell type, we talked about the morphological changes which occur in the cell and the cell degeneration. We said that the degeneration is a type of subepithelial, sublethal cell damage due to ischemia, hypoxia, or infection, which lead to reversible changes of the cell. When the morphological changes commonly featured اللي هي swelling of the cells due to water accumulation, the granularity of the cytoplasm, and a nucleus. The most important part, the nucleus is normal. So when the cause is removed, the cell can recover to normal. قلنا عندنا الأكيوت والكرونيك اللي هي الأكيوت بنسميها الكلاود سويلنج والهيدروبيك سويلنج. وعندنا الفاتي changes. الفاتي changes due to the position of the fat tissue. So الكلاود swelling هي common organs to have الكلاود swelling والهيدروبيك changes اللي هي الليفر or kidney and the heart. بيحصل في الميتوكوندريا والاندوبلازميك ريتيكولم، بيحصل forming of الانترا intracellular vacuoles، وبيحصل capillary compression but nucleus is normal and the cell membrane is intact. The membrane is intact. So بيحصل this is the characteristic features of the gross appearance or the macroscopic appearance of the cloud swelling of the liver. بيحصل liver is swelling, increase in weight, become pale to soft, rounded borders, and surface showing cloudy, bulging outwards. Other organs to be associated with the cloud swelling is the kidney. بيحصل increasing طبعا in the size، بيحصل swollen, pale, soft, rounded borders, and cut surface cloudy, bulging outwards. usually قلنا soft في الكدني بالذات عشان تعرف الفرق بين الكرونيك والأكيوت. في الأكيوت you can differentiate the different macroscopic appearance of the kidney اللي هي الcortex medulla and the outer capsule. Still you can recognize the features of the kidney في acute inflammation of the kidney. You can recognize this is the cortex, this is medulla, this is the calcium, and this is the membranous, but it is swollen, increase in size, pale, soft, rounded borders, and the cut surface in bulgy structures. الهيدروبيك changes الهيدروبيك degeneration اللي هي بيحصل accumulation of water اللي هي more severe form of cloudy، هي نفسها الكلاودي لكن more severe type of الهيدروبيك a more swollen vacuoles ballooning of the cells. You can see it even under the microscope. زي ما قلنا بتشوف vacuoles، بتشوف السيل فيها vacuoles. But this is hydropic changes of the cell injury. It can occur in certain sites at the epidermal cell في البيرن في الارتكاريا with more swollen vacuoles. الفاتي changes قلنا نوع من انواع الليفر. Common site is the liver، بيحصل deposition of the lipids due to hyperlipidemia. بتشوفي السيلز الفاتي changes in the liver بتشوفيها طبعا هتكون grossly الكاركترستيك فيتشرز هو الميكروسكوب دي هنشوفها تحت هسه ايش شارح عليك بقى لما رصت لكن should be more clear down اللي هي الليفر is swollen, pale yellow, soft, cut surfing, bulgy and greasy like a cheesy like. Under microscope liver cell degenerations اللي هي swelling, ballooning, cytoplasm granular, intracellular بتشوف الفاكيولز, compressed vessels, nuclei. And nucleus is changing. Under the microscope, the hydropic changes and the fatty changes more or less are the same. The most characteristic point to differentiate between them is the macroscopic, because the fat or the lipids, when it goes under the process of staining and molting, the fats will dissolve. Still you see more spaces, more vacuoles. Under microscope, you see the spaces. شايفينها؟ لأنه الفات حصل لها degeneration by the substances اللي انت عملت بيها. في more or less under microscope it will appear like the hydropic changes. فالهيدروبيك changes or swelling changes or degeneration changes common to see في liver cells في kidney cells, and you can see it in the burns. It is an accumulation of the fluid in the cell. When it is an early amount or early stage, or the amount of water osmosis is little, you see it cloud swelling. When it is high amount and the prognosis, the process of the water osmosis is very high, we call it hydropic changes. The fatty changes is the chronic type of irreversible cell injuries under microscope. An irreversible cell damage عرفتوهم إنهم نوعين صح؟ There are two types, necrosis and apoptosis. Necrosis is the cell pathological condition of the cell death. Apoptosis is a normal physiological process of cell death, not due to disease. It could be due to disease in the cancer. When there is a hyperproliferation of the cells, the process of apoptosis will be hyperproliferated. لكن necrosis is a cell death due to injurious lethal factor as cut of the blood supply, infection, allergic reaction, whatsoever the stimuli or the underlying cause. And it occurs either directly or follows reversible injury. So death of large amount followed by acute قلنا فيهم coagulation والcaseous والliquidative والfat necrosis. طيب. An infarction due to reduction in blood supply or cut off the supply. So the affected parts will be opaque, white, waxy, firm, wedge shape. Usually common coagulative necrosis in the kidney will be in the اللي هو الكورنر اللي انتوا شايفينه ده. اللون يلو ده. This is coagulative necrosis of the kidney. طيب infarction of the spleen نفس الفكرة. Usually it's commonest in the triangle shape or wedge shape. Wedge shape لأنها بتكون البلد سبلاي بتبدأ معاك وبعدين بتكبر بتديك الكاركترستيك فيتشرز دي. بتكون الخلايا بتموت صغيرة، كل ما تكون بعيدة كل ما تموت in a triangular shape. So the affected part is opaque, white, waxy, firm, wedge shape. This is the commonest feature of infarction, and commonest to occur in the liver and commonest to occur in the kidney. Myocardial infarction, also it occurs in the heart. برضه بتديني coagulative necrosis of the cardiac muscles. It's going to be opaque, waxy, firm, wedge shape. كل الcoagulative necrosis عندها this characteristic في الهارت failure. هنا بتشوفيها في myocardial infarction of the cardiac muscles. You see that the cardiac muscles being coagulative necrosis. قلنا coagulative necrosis usually infarction due to infarction and due to reduction in the blood supply. It gives you a wedge shape, and commonest to be in the heart, in the kidney, and in the spleen. تمام. الcaseous necrosis usually commonest في tuberculous lymphadenitis. Usually it's an infectious causes. So common to occur في lymph node. You can see it in different places. But الcaseous necrosis, which is the characteristic features of tuberculous lymphadenitis, and commonest to occur in the lymphatics. بتكون الcaseating material بتكون dry to soft, pale yellow, resemble casein or creamy cheese. Very characteristic. الcaseous necrosis أول ما تقطع تعرفها tuberculosis زي الجبنة، بتفتوي زي الجبنة, cheesy-like appearance, and it's like a whitish, and it's found in a circular manner because الcaseous necrosis occurs in the middle of the necrotic area, caseating materials. So it usually appears in the circular or a very demarcated features. A liquefactive necrosis common to occur in the brain, and presence of a soft cyst with liquefied center containing necrotic debris. شايفينها usually in a form of cyst تلقى liquid زي liquefative necrosis. يحصل cell death ويحصل لك production of fluid materials. From its name, الباثولوجي ده زي ما قلت لكم اول يوم، الباثولوجي ده اجمل حاجه فيه انه اللي بتشوفه بعينك عنده كاركتر، هو اسمه ده اسمه، ما عنده حاجه مختلفه. يعني it's a cyst من اسمها اللي بتشوفها بعينك is a cyst fluid like material, well circumscribed material, liquid in structure, presence of a soft cyst with liquefied center containing necrotic debris. This is what we call necrotic necrosis. So fat necrosis in acute pancreatitis commonest to occur in pancreatitis. The pancreas and adjacent fat show white calcified patches of fat necrosis. بتكون in the form of patch حتات بعيدة من بعض due to fat necrosis ومن اسمها adjacent white calcified patches of necrosis. So these are the characteristic features of the necrosis. ممكن تكون coagulative necrosis. The coagulative necrosis usually resulting from reinfarction. Caseous necrosis usually affecting from infection and commonest to occur in 90% is tuberculous lymphadenitis, and it commonly to occur in the lymph is following a circular manner, and the central material is very cheesy-like material. Liquefactive necrosis, from its name, it's a liquid-factive necrosis. The fluid will be in a cyst shape, well circumscribed, and commonest to occur in the brain. Fat necrosis common to occur in pancreas and due as a result of acute pancreatitis. It appears in the patchy characters of the fats. طيب. This is a characteristic features of dry gangrene. Affected part dry, shrinked, black, less offensive odor, and less toxemia. Usually gangrenous is resulting from ischemia. طيب المويست gangrene بيكون black, edematous, offensive odor, and marked toxemia. هنا a dry gangrene common to occur in the peripheral parts. while الجت commonest في الgut. This is the gut features. It's a moist gangrene. Large intestine. Commonest to occur in the large intestine. Gas gangrene, which is a production of gas and caused by anaerobic bacteria, اللي هي commonest to be Clostridium, common in diabetic septic food. طيب, tuberculous lymphadenitis, these are the gross macroscopic features of the necrotic features and different type of necrosis. Under microscope, the tuberculous lymphadenitis are causing necrosis of the lymph node بتكون caseating granuloma. Usually the preferred characteristic بتكون different multiple circular necrosis with caseating material in the center. Very characteristic. لو شفتها تاني will never forget it. On spot diagnosis, though homogeneous, pink, structureless, granular cytoplasm, and loss of the nucleolus. You can see Langerhans cells, which is multinucleated giant cells with nuclei arranged in horseshoe pattern اللي عليها السهم دي اللي انتوا شايفينها. This is the exact features of tuberculous lymphadenitis, caseous necrosis of the lymph nodes with Langerhans cells. Spot diagnosis. Under the microscope for the myocardial infarction or for the coagulative necrosis, coagulative necrosis usually resulting from ischemia, resulting from the infarction. So infacted part هتكون homogeneous, pale, pink, structureless, granular cytoplasm, and loss of the nucleus. So loss of the nucleus لأنه حصل لي cell death. Lined by zone of congestion plus inflammatory cells. الصورة دي cross sectional. في الطرف ده الانفلاماتوري cells. هي باينه مقطعه مربعات كده لان السكشن مخصوص كروس سكشنال. تمام. فدي is the very characteristic features of myocardial infarction under microscope. You see there is infected homogeneous pale pink structureless granular cytoplasm and loss of nucleus.